Welcome to the Global Reader. Today, we delve into the life story of Florence Nightingale, a figure whose name is synonymous with compassion, discipline, and systemic reform. Born into privilege in 1820, she chose a path that was radical, challenging, and ultimately transformative. She is the revered founder of modern nursing, a woman whose unwavering commitment to alleviate suffering created a new professional vocation. Nightingale's journey takes us from the drawing rooms of affluent Victorian England to the devastating military hospitals of the Crimean War. Her story is one of data analysis as much as it is of tenderness. This narrative is a comprehensive guide to medical and caring vocabulary. We will integrate words such as sanitation, mortality rate, diagnosis, protocol, and rehabilitation. By understanding how Nightingale used these concepts to battle contagion and infection, you will gain the essential vocabulary to discuss health, humanitarian work, and institutional change with precision and fluency. Chapter 1: The Vocation and the Victorian World. Florence Nightingale was born in Florence, Italy, the city for which she was named to wealthy, affluent British parents. Her early life was spent in the luxury of grand country estates, receiving the kind of liberal, high-quality education typically reserved only for men at the time. She was expected to follow the common protocol for a woman of her class, to marry well and live a life of social comfort. However, from a young age, Florence felt a powerful, almost spiritual vocation to serve others. She developed a profound dissatisfaction with superficiality of the social life around her. Her mind, sharp and analytical, was drawn to mathematics and philosophy, not embroidery and balls. When she first declared her intention to become a nurse, her family reacted with dismay and horror. In the mid-19th century, nursing was not a respectable profession. It was associated with poverty, drunkenness, and poor working conditions. Hospitals were places of last resort, often filthy and dangerous, more likely to spread disease than to cure it. The profession lacked both dignity and systemic structure. Despite her family's persistent and emotional opposition, Florence's unwavering resolve never faltered. She undertook her first official training in 1851 at the Institution of Protestant Deaconesses at Kaiserswerth, Germany. She applied herself with diligence to her studies, absorbing every detail of patient care, hospital management, and basic hygiene. This pioneering step, a well-educated woman seeking formal medical training, set the stage for her eventual reforms. She knew that compassion alone was not enough. It had to be paired with scientific knowledge and rigorous protocol. Chapter 2: The Crucible of the Crimea. In 1854, the Crimean War erupted, pitting Britain, France, and the Ottoman Empire against Russia. News from the front lines began to reach the British public, painted a picture of devastating failure, not on the battlefield, but in the military hospitals. Journalists reported the shocking suffering of the wounded soldiers. They described scenes of total disorder, with soldiers dying from neglect and entirely preventable diseases. The lack of sanitation was astonishing. Soldiers often lay on wooden floors caked with dried blood and waste. There were no basic amenities like clean linens, soap, or proper food. The mortality rate among the injured was staggering, far exceeding the death toll from battle wounds. It was clear that the greatest enemy was not the Russian army, but infection and rampant contagion. Responding to this public outcry, Sidney Herbert, the Secretary at War and a close friend of the Nightingale family, formally asked Florence to lead a team of nurses to the military hospital at Scutari, Turkey. She accepted immediately. She gathered 38 volunteer nurses, many of whom lacked formal training, but possessed the same deep sense of vocation. Upon arrival at Scutari, the scale of the disaster was overwhelming. The hospital was essentially a massive, filthy barrack. Wards were overcrowded, lacking ventilation, and the stench of decay and disease was acrid. A quick diagnosis revealed that diseases like typhus, cholera, and dysentery were spreading like an epidemic through the crowded, unsanitary conditions. The nurses realized their primary battle would be against filth, not against wounds. Chapter 3: Data, Diligence, and Systemic Change. Faced with this chaotic environment, Florence Nightingale did not simply resort to acts of compassion. She applied her analytical mind. She understood that emotional care was vital, but systemic reform required proof. She began to collect statistics on the causes of death. Her meticulous data collection became the most powerful tool in her advocacy. She proved with irrefutable numbers that 84% of the deaths were not from battlefield injuries, but from preventable diseases caused by poor sanitation. This data was irrefutable, a diagnosis that demanded immediate action. Nightingale's first protocol was simple but revolutionary: cleanliness. She insisted on scrubbing the wards from floor to ceiling. She ordered larger quantities of soap, brushes, and clean water, often using her own funds. She oversaw the disinfecting of every surface. She ensured that all linens were washed regularly and that fresh air was circulated. This rigorous protocol was implemented with unwavering diligence by her team. The impact on the mortality rate was dramatic. Within 6 months, the death toll at Scutari plummeted from over 40% to just over 2%. This achievement demonstrated the efficacy of a public health approach. It was a pioneering moment for modern medicine, proving the link between hygiene and health. It was during this period that she earned her famous nickname, the Lady with the Lamp. She would make rounds alone at night, carrying a lamp to check on the wounded. This image of her unwavering endurance in the face of suffering was captured by the press and broadcast back to a grateful nation, cementing her iconic status. Her presence provided immense comfort and assurance to the soldiers in the crowded wards. Chapter 4: Rehabilitation and a Formidable Legacy. When Florence Nightingale returned to England in 1856, she was a national hero. She was welcomed home with immense public acclaim, but she slipped quietly back into private life, avoiding the scrutiny of public fanfare. She was, however, far from finished with her work. She had contracted a debilitating illness, likely brucellosis at Scutari, which left her chronically ill and largely housebound for the rest of her life. Yet her illness did not weaken her resolve, it merely changed her method. She transformed her sickbed into a command center for systemic reform. She wielded her data and her formidable will to pressure politicians and military leaders. She became a tireless advocate for public health reform. She used her statistics to show that British soldiers were more likely to die in barracks at home from disease than to be killed by enemy fire abroad. This compelling evidence led to widespread improvements in military and civil sanitation. In 1860, she used a fund raised by public subscription to establish the Nightingale Training School at St. Thomas' Hospital in London. This was her most lasting legacy. It established nursing as a rigorous, respectable vocation based on intellectual knowledge and moral discipline. The protocol taught at this school focused on hygiene, patient observation, and compassion was adopted worldwide. She also pioneered the concept of rehabilitation, emphasizing not just curing disease, but restoring patients to a functional life. She stressed the importance of mental health, amenities like sunlight and conversation, and reducing the suffering of the long-term sick. Her humility was evident in her focus on the patient, not her own fame. She devoted the rest of her life with zeal to disseminating these principles, leaving behind a formidable legacy of resilience and change. Conclusion: the enduring efficacy. Florence Nightingale died in 1910, but the efficacy of her work is still felt today. She took a job defined by dismay and low regard, and elevated it to a noble vocation by applying logic and data. She proved that compassion must be guided by statistics. For English learners, this narrative has furnished you with the specialized medical and caring vocabulary. You can now articulate the difference between contagion and infection, the process of diagnosis and rehabilitation, and the importance of systemic protocol and advocacy. By incorporating words like mortality rate, sanitation, and unwavering, you can discuss global health issues with clarity and depth. Florence Nightingale's lamp continues to shine, reminding us that the most powerful reform starts with one person's unwavering vocation and a keen attention to detail.